Hello, I'm going to talk about COVID-19 contact tracing apps that can alert users when they've been exposed to coronavirus. These apps have been developed and deployed in 77 countries and US states. Similar to other pro-social COVID-19 behaviors such as vaccination and mask adoption, the greater adoption of COVID-19 apps improves their efficacy. Yet, adoption has been low, with the highest rate of adoption for each jurisdiction hovering around 30%. And typical adoption rates are closer to 10%. With such low adoption rates, there's been considerable effort to understand what's going on. Prior work in public policy and public health has sought to understand people's considerations for adopting such apps through self-report and lab-based studies. These works suggest that people's adoption is likely driven by two things. First, people have concerns regarding the app's privacy and data collection practices. And second, there are perceptions of whether the benefits of the apps to themselves or to society outweigh these privacy and data concerns. However, none of this prior work has observed how these considerations affect actual adoption of these apps in the wild. Self-report studies on privacy-related behavior have known flaws due to the privacy paradox, which show a disconnect between one's belief about privacy choices and one's actual behavior. People will claim that they would choose a more privacy-oriented product, but when observed making such decisions, in real life, they often forgo privacy protections. Thus, to offer real-world insights into users' adoption of privacy-sensitive health applications in the context of COVID-19, we conduct the first, to our knowledge, field study of COVID-19 app adoption. In our field study, we asked three research questions. First, is messaging that presents the app installation as a collective good appeal more effective than a messaging that appeals to an individual good? Second, is messaging that makes privacy transparent and data collection transparent more effective than messaging that does not? And how do demographics like age, gender, and geography moderate the user adoption? To answer these questions, we collaborated with the state of Louisiana to conduct a randomized controlled field experiment on adoption of the state's COVID-19 exposure notification app called COVID Defense. Specifically, we tested the impact of advertisements run through Google Ads platform using 14 different ads. Ads were randomly displayed to Louisiana residents in February 2021 and generated 7 million impressions. We measured whether the user clicked the respective ad and used the ad's click-through rates to perform our analysis. Those who clicked on the ad were redirected to the Louisiana Department of Public Health app download page. Along with click-through rates, we also observed measures of demographics, like age, gender, and community density. Demographics are provided through Google Ads metadata. Age and gender are inferred by the Google Ads platform through past browsing behavior, and the accuracy of these inferences has been validated against gold standard social scientific probabilistic survey panels and other self-report data sources. The text of the 14 ads was chosen to align with our research questions. First, one of two appeals appeared at the beginning of the ad text. An individual appeal, get notified of COVID exposure, or a collective appeal, reduce the COVID infections. We selected these phrases based on a pilot test in collaboration with the state of Louisiana, in which the market research firm surveyed approximately 800 respondents to identify the best message phrasings that were most appealing on a variety of criteria. This allowed us to adopt already successful messages and investigate through a randomized study how the type of appeal, as well as the privacy and data transparency messaging, affected app adoption. Following the appeal, either one of three privacy transparency statements was added, and there was no privacy statement. The privacy statement either was broadly stated, or it had a technical statement, or a non-technical statement. Finally, a privacy statement could also have been paired with a data collection statement, where the data collection statement was the app uses information about who you have been near. Each of these ad text combinations was presented in a different ad campaign, which were run concurrently on the Google Display ads over the month of February in 2021. Moving on to our results, we see that even when we control for other experimental factors, advertisements mentioning individual good perform significantly worse than those that use collective good appeals. Given that the US is a highly individualistic country, it is perhaps surprising that collective good appeals are more effective. However, prior work finds that Louisiana is the most collectivist US state, where collectivists tend to engage in pro-social behavior that benefits the in-group rather than pro-social behavior that they perceive as benefiting themselves individually. This effect may explain why residents of Louisiana respond best to socially oriented benefits. On the other hand, it may simply be the case that people understand that the primary benefit of a COVID-19 exposure notification app is indeed collective, and that people respond best to messaging that is honest and transparent about the true benefit of the app. Our findings for transparency regarding privacy and data collection are, however, more nuanced, and our conclusions depend upon the type of appeal that was made. Transparency about individual data collection improves the efficacy of messages that are already individually focused, those with individual good appeals, while the same transparency statement applied to collectivist setting appears to conflict with people's sense of a collective purpose. Related, transparency regarding privacy and how individual data is protected in a collective setting may reduce concerns about a communal context, while the same transparency may be ineffective or even detrimental when placed in the context of individualistic privacy benefit trade-offs. Moving on to demographics. Overall, we find that men, especially those who are middle-aged, and when presented with an individual good appeal, are far less likely than women to click to install COVID defense. Prior literature finds that men have lower perceptions of the COVID-19 risk, and we hypothesize that this large gap between men and women, which is especially pronounced when presented with an individual good appeal, is driven from this gender-based risk difference. Differences between men and women also exist for privacy and data transparency statements. The overall transparency effects from the previous slide are primarily driven by men's responses to these statements. Women are unaffected by the inclusion of privacy and data transparency statements in collective good ads. We hypothesize that this is the case because women are more relational or focused on the collective good. The results of our field study show that tailored messaging can effectively influence the pro-social behavior of installing a COVID-19 app. While significantly more people click on messages that use collective good appeals than those that use individual good appeals, collective good appeals are even more effective when paired with a privacy transparency statement, but are less effective when additionally paired with a data transparency statement. Individual good appeals exhibit the opposite effects, and such differences suggest that digital privacy and data transparency can be effectively provided through tailored messaging, but we must think carefully about how an application's purpose and framing may impact people's privacy considerations and reasonings. Our findings offer insight into how users make privacy benefit trade-offs when making decisions to adopt an app in the wild. There's a tension between one's desire to improve community health by sharing personal data and our individual desire for privacy. This work and similar field study work, like it, can and should be used to provide guidance to public health departments. These findings may aid companies and policymakers when promoting digital tools to improve public health, and especially those tools that have implications for privacy.